Thank you for what you all do. Wow. It's amazing. I'll apologize from the front end and never again that I'll hack and cough and pollen is everywhere. And so am I right now. I don't know how you do what you do in the midst of the trauma and the suffering and grief. And that's what I'm going to be addressing. We do, chaplains, physicians, nurses, we are and we do become affected by the outside terrain, the outside people, the outside story, and it affects us on the inside. And if I could get you to accept that first, then there's hope. We need to recognize and accept that the grief and the suffering and the trauma we're in and with does affect us. And we'll call that emotional germs, but I'll talk about emotional germs in a moment. Now, Tweety Bird says it best. Y'all know Tweety Bird? He's a cartoonist. Listen to this. I mean, he knows. Dear Lord, so far today I'm doing all right. I have not gossiped, lost my temper, been greedy, grumpy, nasty, selfish, or self-indulgent. I have not whined, complained, cursed, or eaten any chocolate. I have not charged nothing on my credit card. But I will be getting out of bed in a minute, and I think that I really need your help then. We are affected, aren't we? You all know that as much as anyone. And that is what we're going to try to do today, is talk a little bit about secondary trauma, some of the symptoms of that, and then some of the things we might do to cope with and manage the traumas that begin to be inherited within us from the patient experience. First of all, let me name some thoughts about a hospital. I call a hospital an anxiety house. Now, I promise you, executives don't like to hear that. It's supposed to be hospitality and a hotel, and people want to be here. No one wants to be in the hospital unless you have to. And when people come into a hospital, they look, and this is one of the few structures in our culture, the steel, the glass, the brick, that tells us, that tells me, I am not going to live forever. Even if you give me another liver, I'm not going to live forever. I will die, and I may suffer. Hopefully in this hospital there is comfort for me. But so many people can experience the anxiety in this house the moment they come in and smell it. And it takes them back to memories of years ago sometimes. And I've literally sat with people in the front lobby, helping them process and breathe again, getting through their anxiety attack, their panic attack, in order to go see Grandma upstairs. Patients in a hospital are wondering, can I trust this physician? Can I trust this nurse? And particularly if you know what debilitating pain is. If you don't get that medication within 20 minutes after it's supposed to be given to you, you have to have more medication to get out of debilitating pain than if you have it on time. And you begin to wonder, can I really trust? Will they be there for me? If I could put you in enough emotional and physical pain, I would cause you to regress in behavior. One of the things that patients do, and the patients that you work with, they begin to regress in their illness and in their pain and their suffering back into childlike behavior, even to a fetal position. Have you seen this? But they begin to act like 3-year-olds and 2-year-olds because when our anxiety and stress goes up enough, we begin to regress back, and we use coping mechanisms as children. And when the nurse says he's acting like a 2-year-old, he's supposed to be acting like a 2-year-old. The question is, can we meet a 50-year-old as a 2-year-old emotionally and maybe spiritually for a while? Hopefully they won't regress back into the fetal position. Hopefully we won't have to help them with the labor and contractions back into the womb of God in death. But hopefully they get to this point where we help them grow back up to where they are at 50. You're in the middle of that. You see that. You're part of that. But unless you don't remember, let me just bring you to some cases that might help us all get focused. Imagine that you are the interpreter, okay? A 2-year-old somehow has jumped or fallen on a glass table, cracked the table, cut himself wide open, and has the blood has bled out of his body. In the emergency room, the mother who was at work has scrambled in. The father who was at home but took a nap. Do I have to say more? The anger, the guilt, the sadness, the baby's dead. And we're in the middle of that, you and I, and the doctor, trying to help them. CPS has arrived. You've been there, haven't you? And you're translating in the midst of all of this. Well, how about another? A young woman, I'm called to the emergency room. A young woman is on the ground of this family room on the floor, and she's pounding her head on this carpet, which is concrete underneath. Blood is all over her, and she's yelling, "No, no, no." The nurse is trying to help. I begin to try to help protect her head. What we began to find out is that her fiance had backed into someone's truck at 2 a.m. at a club, and the man in the truck pulls out a shotgun, lets him have it right in the face. He's dead in the moment. They put him in the back of a car. She cradles his head. No, no, no. Took hours to get her out of that state, to get family there. And you're the interpreter. There's a car wreck. We read about them every day, don't you? But are you in the middle of them every day? Sometimes you are if you're an interpreter in the emergency center. The car wreck has involved a family in which all 4 die except for a 9-month-old. And everyone's trying to manage the pain of aunts and uncles and friends who are rushing in to try to care. Have you been in community violence yet? You know, Sandy Hook. Yeah. Boston Marathon bombing, and you're the interpreter. Studies have demonstrated over and over and over that physicians, nurses, healthcare people absorb what is called and develop what is called secondary trauma. So that they begin to, through osmosis perhaps, while denying that it's bothering them, they began to internalize within them the trauma around them until sometimes that trauma, secondary trauma, can lead them to the point of compassion fatigue. We'll talk more about that. My point is, the outside does come within us. We absorb what is around us, and the first position of staying healthy is to recognize that and not deny it. Whether you're a doctor, nurse, or whether you're the interpreter or chaplain. To not deny that this emotion doesn't become like an emotional germ. And the emotional germ is that which gets contagious upon you, sometimes realizing it, sometimes not, and it begins to internalize in your body. We'll look at how that happens, but I want to make a corrective. It's very important to hear this corrective. When I say emotional germ, I'm not talking about their shock and their yelling and their anger and their sadness and their depression. That's their gift. I didn't say the gift is to lose your child. I said grief is an unwanted gift which fills up the empty space until we can make the adjustment to the physical, painful loss. It literally helps us heal. How do I convince you that the role of healthcare is not to make somebody smile and feel better? The role of healthcare is to help someone feel what they feel so they heal better. And sometimes we get caught up in trying to make people happy rather than helping them name the pain. So I want you to hear that the pain itself is a gift that we use as a vehicle. I believe it's given to us by God in order for us to make the transition, the transformation, sometimes months, sometimes years, and then you know it peekaboos in you when you've lost somebody, a child, and it'll come back 5 years later, 10 years later for a peekaboo approach. These are emotional germs when they come to you, but they're gift to that individual. What they have is not a germ. You follow me on that? It's very important because if you think that's the germ, that they're a germ, you will not be able to stay with them. The emotional part is that which you absorb in you because you are a human being with compassion and because you are normal. If this is true, what effect? What does this emotional germ, we got it now, right? It's a gift to them, but it gets into us, affects our lives. What does this do to us? Well, you know, it affects us physically, emotionally, mentally, behaviorally, all the spirit dimensions of that. But I want to name a few because you need to understand that every one of us in this room are different. You would respond differently to the emotional germ in a certain situation than you. Each of us are different. We can be in the same automobile, the same wreck, have almost the same thing happen to us as the person next to us. But because we have a different history, a different family language, because we view it differently from our past, we're not the same. So when I list these stressors, don't go out and feel like you got to go find them and make them happen, okay? I'm trying to say these are some of the weaving of stressors, of emotional germs, of secondary trauma that could get under your skin, and you need to know what they look like. So let's talk about physical for a minute. The physical effects. Increase in heart rate. Blood pressure goes up. The immune system goes down. You have a loss of appetite. Insomnia. Fatigue. And when you go home after you've worked with a family whose baby has just been lacerated and died, how do you do it? Everybody does that and are affected differently. And sometimes it's weeks before it turns up. Or sometimes it's when we get with our own children doing something that it surfaces. What about the mental dimensions, the mental effects? Flashbacks. You get on your way and you flash back to what happened yesterday or last week. The inability to concentrate. How do y'all do your work? It takes such powerful concentration, I would guess. And I don't even know how to speak languages. All the language I took, I can't use any of it. But that certainly is a focused task for you. And a lot of times these effects will literally cause you not to be able to concentrate, or you become preoccupied with the events of your life, with confusion that's going on inside of you. Over-identification with the situation. How many of you have worked in a situation, interpreted in a situation where a child has died? Look around. This is one of the most difficult for all of us. Over-identification is when it happens here, you absorb that and it becomes an anxious sort of thing. You think of your own child, and the next day you find yourself more protective and careful, and you're over-identifying here, and you're becoming a different parent over here. And some of that can cause you to hug your child more deeply and profoundly, and that would be a positive. But if you keep hugging a child deeply and profoundly, they finally grow up to be teenagers and say, back off. You know what I'm trying to say. You can get enmeshed in over-identification. So watch inside yourself how you do that. The event you're in. The event you're in can resurface inside you events from your past. We won't go so far as call it post-traumatic stress disorder. It could be in that family, but you could have some events in your past. The death of a parent. The dramatic death of a grandparent even. And you're in the interpreting situation. And you did not even know that all of this can resurface while you're in that role of helping doctor, nurse, family, patient, interpret and understand each other as they talk about this trauma. Emotional effects. Anxiety, sadness, depression, anger, frustration, irritability. You go home and your spouse has no idea where you're coming from. It just kind of is there. And you may not even know it yourself. There is in this emotional distraught or this emotional stressor the lack of enjoyment of life. Sometimes you'll notice the joy in life is depleted. And that can be one of the signs of the heaviness of secondary trauma. Apathy might be another word for the lack of enjoyment. Apathy in terms of you stop caring, become apathetic to human pain or apathetic to people around you and to needs around you. Now let's look at behavior. Have you found any of yourselves yet? Now let's look at behavior. In this state of secondary trauma, one can literally begin to withdraw from others, particularly others who need them. Like kids? We begin to withdraw within ourselves. We can't be there for others in this behavioral change. The behavioral change means also we may not be able to eat. Now, some of us have the opposite problem, right? We eat too much in these kind of stressor times. Somehow trying to nurture ourselves with too much. A loss of energy. Overprotective, which we've kind of pointed out already. Misuse of alcohol and drugs. Misuse means you sometimes overdo in order to saturate that which you're not processing, that which you're not dealing. as I talk, do you find yourself identifying with any of this? And you have your own other ways. And I hope you're hearing me that not everyone in this room is affected the same way. But you do head into trouble if you try to deny that you're affected at all. And chaplains are real guilty about that, I promise you. We're people of God. Doesn't affect us, right? Physicians are real bad about that. I don't want you all to be real bad about that. I want you to know that it is normal, as a normal human being, that you would be affected by trauma around you. It may have degrees. It may be a lot with how much trauma in a row. And you have your own way of responding. But this just kind of points to. And one of the biggies is spiritual. Why? Why? Is there a God when this happens? So that people and we sometimes go through a spiritual wilderness that we have to work with in terms of the suffering that we see in human beings, the trauma and grief that we see in human beings. And we're trying to negotiate their communication, help them with their communication, while also wondering within ourselves the big question of this higher power. Is there a divine power beyond us? Whether we call that higher power or God or Allah or Yahweh, or maybe you're a Star Wars person. Maybe you like the Force. Is there some divine force beyond us that literally joins a divine source within us and really can transform and transcend life? So these are not limited to behavioral and mental, cognitive, and the physical. These are also, for some people, a journey. And when we go into our chaplain residencies, we come out of seminary, go into our residencies, and a lot of times the chaplain is wrestling with this. And if you can get the doctors sneaked off to the side, sometimes they'll begin to openly wrestle with where is God when you cannot be a part of healing the physical. Quite complex. What I'd like to do now is I'd like to turn the conversation or the presentation. If these are some of the possibilities, and we're all different, we must remember that we are all helped differently. I mean, it's so dangerous to say, oh yeah, you need to do this and this and this and this. That helped me. And it may not help you. So what I'm about to present are various ways in which you can find a way to cope, find a way to get through this secondary trauma in a healthy way, and remember that each of these will be different. You'll have a different response. So you may hear one that says, oh yeah, that really helps me. And you'll hear another one that doesn't seem to strike your bell. It doesn't seem to help you through that trauma, pain, grief, sadness. I've said it twice. I think I have to say it 6 more times, right? Until I recognized, Tim Vanduivendyk, recognized that these trauma experiences affect me, I have no way of dealing with them effectively. So I really invite you to recognize what it is that's happening to you when you are around suffering and trauma and grief, and what it is you walk out with, because that prepares the way for everything else I'm going to say. If you're not aware of it, you're not going to try in any way to deal with it, cope with it. So it begins with recognition. The second is affirm yourself when you're feeling like, I'll say it biblically, when you're feeling like dung. Affirm when your feelings are so caught up in the trauma. Affirm yourself that you are a normal, compassionate human being. You've got to start there. I mean, a lot of times our physicians and nurses are ashamed for feeling this. Not true anymore. In these rooms right here in the past 2 weeks, I think, we've had 160 young nurses, and I taught this course with the young nurses. We are now open about how this affects us as professionals, and that we really do have to care for ourselves, just as you have to care for yourself. So affirm yourself first as being a compassionate person, but then take it to another step. A step I had to go to my residency to learn. There is a difference between sympathy and empathy. Sympathy is when you have the same feeling as somebody else, which is impossible. You can be, as I said, in the same automobile accident together. And because of your perspective, because of your past, you will interpret the situation differently. Sympathy is not possible. But many times as professionals, we allow the emotions to become sympathetic, and we literally take on their emotions. Go with empathy. Let me define empathy. Empathy is the capacity to step into someone else's shoes, someone else's frame of reference, and the thinking, the feeling, and the behaviors that come with that frame of reference. But you never take off your own shoes. It's a gymnastics act. Takes a lot of supervision, takes a lot of training. That's what we do in our residencies. How do I bracket myself, empty into their world, be with them in their world with care, with pathos, with emotional connection, but I never lose me? So what we're working on as professionals is not sympathy. We're working on empathy. What empathy does is it helps you develop professional boundary. And we all need professional boundary. Now remember, even when you got it, it's going to get in there, okay? But we all need a little callousness. Uh-oh, did I say that? A minister, a chaplain? We all need to be a little calloused? Let me talk about that a while. You know, are you a wood carver? I'm a wood carver, at least I have been. I need to get back to it some. In wood carving, if you don't have calluses, you can't do the tender slices in the wood for the detail of the carving. Anybody here a guitar player? One of the painful beginnings of being I'm not, so one of the painful beginnings of being a guitar player is to develop the calluses, correct? And when you get those developed, your music becomes more divine, it becomes more effective. It takes months, right? Long time. When I say callous, I don't mean we don't have feelings for another human being. I say in empathy, we have developed the sense of self-boundary in which we've developed the callus which helps us deal with their tender pain better. Helps us deal with their hurt and their grief and their anger and depression better. So we want to be talking about how we can develop the callus so that we can do more tender, effective work. As you know, when you're affected dramatically emotionally, well, I don't know, but I would think this is true. You can't really do the interpretive work you sometimes have to do between these folks because of the stirring of the soul, of the emotions, or the part of the brain that keeps interrupting the cognition. So we need that callus. But we also need to intentionally use the filing system of the brain. Your brain is built in such a way that in the middle of my trauma, middle of this trauma, as I work with this family, I can take this emotion, this rage, this hurt, this sadness, this panic, trauma, and I can decide cognitively to put it in my brain file. And intentionally tell myself, I'm going to take that out later, and I'm going to deal with it. See, the danger of this filing system of the brain is people put it in the file, they shut the filing cabinet, and they, what do we call it? Suppress, repress, and then it starts coming out in ways we don't even know sometimes. So when you're sitting there in the midst of human pain, you might absorb and take that and put it in your file, in your brain, tell yourself, I'm going to deal with that later. You might need a good catharsis later. You might have to have a good cry later, or a good angry scream later. That's part of what helped me is getting in the car at the end of the day, turning up the radio as loud as I could, and literally screaming, which led to tears. And the sadness that came out of that human suffering began to pour out, and I began to feel better. I'm talking about pulling it out of the filing cabinet when you are with yourself, or we'll find some other ways of doing that in a minute. You're with yourself. You're going to open it back up, not repress it, not put it away so it begins to disturb you on deeper levels, but you literally begin to manage it, work with it. You put it back in the filing cabinet. Our memories are always there. And we may have to take it out next week. I have a daughter with Down syndrome, and that's the way my brain works. I can go into spirals of pain. But I've learned to say, okay, put that in that brain file, and we'll process and deal with that later. Coming home from a wedding when she said, Daddy, will you marry me? Well, I knew what she meant. She didn't want me to marry her. She wanted me to be the minister. I married her. And she's 40 and wants 10 husbands. We each have our own personal pain, our own pain that gets vibrated up when we are with individuals. And sometimes you're with individuals who are dealing with a fear, a conflict, a pain, a trauma that's very much like yours from your past. And you need to cognitively take it, intentionally put that in the filing cabinet, because later you're going to take it back out and have your catharsis. A number of ways to get that catharsis. You know what catharsis means? Release, letting go. We theologians call it confession of the human condition. It's the naming and releasing of the soul's pain. That's yuck, that stuff that gets caught inside of us. That literally can pull us down into living that's not abundant, that's not full. It blocks that abundance. One of the ways we can do this is be with family and friends who love us. By the way, this is not to be the time you need to spend a lot of time with the family and friends who are knee-deep. Don't ditch them. They're great friends. But you know what I'm saying, don't you? you have friends that are needy and they need from you, this is a time you need to be surrounding yourself with loved ones and family, spouses who do not need a lot for their care. We'll trade out and we'll do that next time. But literally surround yourself in that environment, and while you do that, choose what I call a debrief partner. Debrief partner. You're familiar with, and all of our chaplains are certified with critical incident stress management. One of the first things you do with professionals, nurses, doctors, is you have a debrief session. Get that out. Let's look at it. Make sure we know it's there. There are other things that happen later, but the debrief session is when you sit with someone that you trust and you begin to name the situation, and if you want to cry, you can cry. If you want to anger, you can anger. You can say what you need to say. But let me tell you something. The moment they say, oh, I understand, let me tell you about my experience, that's not a debrief partner. You've had that too, haven't you? Or if they begin to try to make you feel better, rather than help you feel what you feel, go get another debrief partner. The debrief partner knows to let you have some time to cathart, to name it, to get it out, into awareness, into consciousness, so it doesn't sit there and get sick inside of you. Now, if both of you need some help, hey, you take the first 30, I'll take the next 30. So you don't interrupt each other's stories. That's the way I work with families. I have grief dates for parents whose children are dead. And they literally, without talking about the refrigerator and without having to have, trying to get into sexual romance, they literally are assigned to come together for an hour, and they must talk about their child and grieve and hurt together rather than walk around the house and try to avoid each other and talk about everything else in the world. Get a debrief partner, a listening partner. Tell them what it's like to be I call it sojourner in the book, and have steps for how you do that. But tell them what you need. That you need just 30 minutes to name it and cathart it and get it out. That can be very helpful. And hopefully you're becoming a debrief partner to each other. We have chaplains who literally get together and name it and get it out. And I know physicians do that too. Differently sometimes. I know nurses do that too. Interpreters, you need a debrief partner. You work in a world filled with pain and conflict, and that does touch you deeply. Counseling, okay. A counseling is a coach. If you wanted a better swing in tennis, you go get a coach, right? A counselor, all they are, a therapist, all they are is somebody to help you swing better. I don't know why we have this block about, hey, I need to go to you. I got some stuff here I'm not swinging very well about. I got some stuff here that's getting me down. I got a marriage and there's conflict here. Get, if you need be, a counselor, a coach who can support you, help you name it, help you get through your deepest experience. And sometimes, I remember a pastor friend who was literally driving behind a car, hit another car hit this car, it exploded, he ran to the car, and 3 people were already charred, already dead. I mean, just poof. And for months, this guy would call me out of Athens, Texas. I need to talk some more. That's how you get through. That's how you work through these tragic situations. You know the usual, don't you? Eat healthy, Exercise regularly. And I'm a physical education major, and I'm in Athletics Anonymous because that doesn't help me at all. Exercising is something I gave up when I left Baylor and went to seminary. Worst thing I ever did was give it up. So it's not the thing for everybody. If my wife says, let's go walking, I'll get stressed. Confession. But some kind of activity, some kind of busyness, eating right, exercise. You all know these normal things like sleep regularly. Way to go, chaplain. What you just told us is you have insomnia. Yeah, sometimes it's affected. But do your best to find a regular sleep in your life so that, if you don't get 8 hours of sleep, you gain weight. Is that what I heard someplace? Good for you in a lot of ways, I guess. So next time on a diet, I'll get more sleep. Love and play, pray and laugh. Now, even to the point of sexual involvement, relationship, a closet of closeness that comes in sexuality. But folks, hear this. Some of us in the midst of secondary trauma, absorbed in this, need to be held but not genitally involved in sexual relationships. Some of us, we don't know how to hold, we just want to be in sexual relationships. And it helps us. We're all different. But loving and all the dimensions of love that come with it, procreating and recreating the world in sexuality, can be a resource of love. And you know, laughter. I don't know if you've noticed, but the deeper you go in the emergency center and the deeper you go in the surgery center, the yuckier the jokes. And I think it's because of humanity. It's so difficult to deal with the humanity of surgery, amputation, and to be in that emergency center. So humor is one of the key ways to laugh deeply, key ways of getting through all this, and to learn to play. I know how to play. I don't exercise, but I know how to play. But find your play place. What is it? You know? Jean and I have this thing in the backyard in 2 rockers. We're old folks now, right? No kids around to interrupt us every 2 minutes. We get some Baptist tea, whatever you think Baptist tea is, and we sit and we sip our tea, and we talk and we debrief our roles and where we are. We both work in hospitals, and the kinds of things that happen. A love in that, a sharing in that, a debriefing in that. Don't expect your partner to do all that for you, okay? Jean cannot take care of all my needs in this area. I literally have to find peers to process the pain. But spouses, partners, lovers, friends can come together and support each other in those rituals of love and play. Activities, hobbies, you all know that. I'm a wood carver some days. I love to work in the yard some days. But anytime you do something, and it can include reading and journaling, but anytime you do something with your hands, your depression, your sadness, your trauma begins to follow your hands. Okay? So if you are doing something with your hands in the midst of these times, it can be a real resource to you. So find your hobby, find your way. Well, I had to deal with something that you don't have to deal with. And it's called the God complex. Some of us in theology call it the Messiah complex. In that, we ministers think that we're supposed to be able to change this. We're supposed to be able to say it or do something in which we literally help somebody out of their pain. I worked with a family whose 17-year-old was unconscious in intensive care, and Scott died within couple of weeks, and I got close to that family. And in the residency, you write this stuff up, you bring it to your supervisor, and I brought it to Tom Cole, my supervisor, and you look at the sociological, the theological, the psychological dimensions. You look at different interventions, new ideas. And he says, you did pretty good. And he laid it off to the side. He laid my verbatim off the side at the end. He said, Tim, you did real good. Good stuff. And then he leaned back and he said, don't take this kid home and pray for him. What? I was new out of seminary. He said, you go home and you play with your children, you be with your wife, you forget this kid so that you can come back tomorrow and better pray for this kid and better support that family. Folks, don't take the family home with you. Leave them. Don't take them home with you, because you will lose energy to continue to come back and help them in their time of need. That's the God complex in me. It shows up all the time. It doesn't go away. I hope you don't have one. But we ministers particularly have to work with that and be reminded we're creature and we're not creator, and we can't change all things or create every miracle we'd like to see. Learn to let go. Let it go. What's that movie? Frozen. Let it go. Let it go. Learn to take an emotional germ bath. In hospitals, physicians and nurses have showered out at the end of the day. Literal germs. Not take that stuff home with family. We need an emotional, spiritual shower. And it's different for every one of you. But you need a ritual at the end of your day. And I was telling you about getting in the car and turning up the radio and screaming, and sometimes that leads to tears. I've gotten older now, so now it's softer music. You each have your way to release it, to enter a spiritual, emotional, physical, behavioral shower in which you rinse away, you soap away the germs with the reality that I must let it go. Let it go. Let it be. Let God. It's funny I should talk about God, isn't it? I'm chaplain. Because one of the key ways for some people of getting through this is spirituality, of faith. It's also, as I said earlier, a time when you really get in some tough dialogues with whoever you believe your God is. But faith and spirituality and prayer and meditation can be primary copers, spiritual copers to help us get through. And what I want to do is tell you about two things. One is tithing, a centering prayer, and it takes 20 seconds. When you're entering that patient's room, take a deep, slow breath at the count of 10. Before you get in there, release that breath in the count of 10 and empty out completely. And if you'll do that before every patient, and including your teenagers and your spouse, you'll be a healthier person, because what you're doing is oxygenating the brain. You're oxygenating your body, and you begin to deal with things better. So tithing, a centering prayer, for some people that means asking the Holy One to be with me, to be with them, to let me give care, to let me be sharp in my interpreting. And another is the work of Dr. Herbert Benson, an MD, a cardiologist in Harvard, who in that same laboratory, Hans Selye discovered the stress of life and wrote a book called The Stress of Life. But then Herbert Benson comes along and he wants to discover, how do you release the stress cycle? So he does all this research, meditation, and prayer, and he discovers that allowing people to go through this process helps them relax the stress response. And I'm going to try to take you through that, not as lengthy as he might want, but I think you'll get a feel for it. Because what I like about what Herbert Benson does is he integrates breath, ruah, breath, breathing and body, and with a cognitive affirmation or prayer. In other words, some kind of, not a beseechment, not God, please help me, or somebody help, but I will make this day. It might be a non-spiritual, non-religious, I will make this day. Or you could come on and as he says, take on a, Lord is my shepherd, God is with me, repeating peace when you breathe. So, you need something brief. It can be positive. It doesn't have to be spiritual. For a moment, get it and say it to yourself 20 times, or at least 4, because you're going to need it later as we go through this. Get a short phrase or a word that you want to repeat with your breathing and with your body. Do you have it? Okay. Let me lead you, if you will. Gently close your eyes or find a place to look at, to focus on. Bring in through your nose deep, long breaths, filling up your lungs, and then slowly releasing breath. Be aware of your breath. Take in a breath deep and slowly, fully. And completely release. Let go. You'll find a pattern that's comfortable for you. Bringing in new breath, new life slowly and fully. Releasing the old. Focus with your mind's eye on the bottom of your feet. Whether or knots, whether strain in your foot and in your ankles, with your mind's eye, release that strain. Move into your calves and knees, your thighs, your buttocks. Untying the knots. With your mind's eye now, focus on the very tips of your fingers and send warmth from your heart into those fingers. Send the blood to warm them. Knuckles and palms, hands and wrist. moving into your forearm and your upper arm, shoulders, finding the knots, the strain. Let it go. Come across your shoulders to the very nape of your neck. And gently and slowly move down your spine, stepping on each vertebra as you go down to the very small of your back. Letting go, letting be, and returning up your spine to the nape of your neck. Moving over the back of your head, over to your scalp and to your brow. Your eyes, your jaws, your mouth. Let be. Let go. Over your chin, into your throat, and down to the very pit of your stomach. Find the knot that is there and untie it. Return your focus to your breath, your deep, slow breath. Taking in breath through your nose, releasing fully and deeply through your mouth. And when you release your breath, say to yourself the prayer or the words that you have chosen as yours. Take in a full, complete breath. And when you empty out, repeat your words, your word. When other thoughts come into your mind, just catch them. Tell them you'll deal with them later. And return to your breath, your prayer, your affirmation. When you're ready, very gently, very slowly, return to this space, this room. Move gently, knowing that any time you want to, you can return to your prayer, to your place. What Herbert Benson found in his studies as a cardiologist is the blood was oxygenated, the heart slowed, blood pressure relaxed, the immune system kicked in at its best, the digestive system kicked in at its best. And if you did this for 10, 15 minutes in the morning and 10 minutes in the afternoon, you could be going down the freeway and be mad as you know what at the person beside you, and you could say your brief prayer, or your brief positive, or your word, and literally your body would physically follow. He discovered this before biofeedback. Nothing's new to y'all, is it? It's just a reminder, and there are multiple ways. It's a reminder that we have ways of relaxing our body, making ourselves healthy, so that we get better mileage on our tires, our spiritual, emotional wheels, by keeping ourselves healthy.